Ladies, we all know how embarrassing it can be if you have to wear a pad when you exercise, or when you cough, sneeze, run, or jump, you're leaking. Well, keep watching this video today and I'm going to teach you what you can start doing, 5 ways that you can solve what's called stress incontinence, that inability to hold your urine when you jump. And that's what we're going to talk about today. So stress incontinence affects so many women, and it's very common but not normal and very treatable, especially without surgery, medications, or strange devices either. And as a pelvic floor physical therapist, this is something that I treat a lot, and it's very treatable as those muscles that control and support your bladder are not working properly, and you can train them to do their job. So if you find yourself in an exercise class and you're wanting to do jumping jacks or jump on the trampoline with your kids and you're scared because you're going to lose bladder control, then that's what I want to talk about today on how we can solve this for you. Now, it's so important to know that it doesn't affect just women that have had a baby before. I think a lot of women will just chalk it up to the fact that I've had a baby, or I've had multiple kids in the past, and this is something I just can't do the rest of my life. I'm not going to be able to jump. I'm not going to be able to run. I'm not going to be able to do those activities because I just pee my pants. Well, that is not true. This can affect women. Postpartum is very common that way, but it also affects women that have never had children before. Now, why is this an issue and what happens to those pelvic floor muscles? That's what I'm going to explain first. So you have your pelvis here, here's your pelvic bones, and as you can see, these muscles down here in red are your pelvic floor muscles, and those support and they provide support to your bladder, which is in front here. Your bladder, your uterus, and rectum sit in this area. You have your abdominal wall here, your diaphragm on top, and your back muscles supporting you in the back. And those are all made up of what's the core muscles in your body. But those pelvic floor muscles, think of them like a basket. So they're really supporting your pelvic organs, and they can be thought of like using like a trampoline. So they have to be able to lengthen, but still have some sort of support there. And then they have to be able to contract and support even more, especially in times where more pressure is being put into that area, like when you cough or sneeze, run or jump, and you're putting more pressure on the pelvic floor area. Now, it's not just that you have a weak bladder. I hear women say that. That is not the case, but many times that signal between your pelvic floor and your brain is not working correctly, so we need to retrain that. And then also, many times those pelvic floor muscles are either too tense, contracting too much and you don't realize it, or they don't have enough strength to really hold it there. Now, when doctors tell you just go do your Kegel exercises and do contractions there, that may or may not solve it, but for a lot of women, that is not the case and not what is solely going to help this problem resolve itself. So number one thing that you can do to start helping stress incontinence is look at your diet with what you're eating and drinking. Now, there are common bladder irritants that can really affect when you go to do activity, that it's going to stimulate that reflex from your bladder to your brain saying, I gotta go, I gotta go. And these bladder irritants happen to be citrus foods, anything highly acidic, caffeine, especially coffee or diet sodas, even decaf tea is a bladder irritant. So anything with artificial sweeteners is being the last one. Now, these different substances that you're consuming before you exercise may actually allow you to have this reaction more often. So cutting those out and doing some bladder training with realizing what you're eating and drinking, that's what I do with my clients. So I see on a bladder log what they're eating and drinking in a 24-hour period. And many times if we cut those back or maybe consume them 2 or 3 hours before you do any jumping activities, doing exercise, then it can help your symptoms too. So it's a combo of things with the muscles, but also what you're consuming in your body can affect it as well. So number 2, working on some breathing exercises. as your pelvic floor muscles sit at the bottom of your pelvis and support that area. It's not only about those muscles, but what's happening at the top is your diaphragm. And so that has to move when you're inhaling and exhaling. So working on some breathing exercises is going to help that pelvic floor area really work more optimally. And many times if we go back to the basics and just learn how to breathe again, it sounds very basic, but it can really help retrain the brain to that signal to your whole core area and get those muscles working properly. So you can go watch one of my videos all on diaphragmatic breathing and go back to that. Those simple breathing exercises can make a huge difference, especially when going into any core or pelvic floor strengthening exercise. You have to reset the brain and how to breathe properly through your rib cage and through your belly again, because that is going to help that area work properly and support your bladder. Then number 3 is really strengthening your core. I'm not just talking about planks or crunches, but I'm talking about specific exercises that, for example, you're going to be thinking of drawing your navel to your spine and working on exhaling at the same time. So we take those breathing exercises and then we integrate it into how to get those core muscles stronger. So many times people think of just crunches or planks as being core exercises, but those are working your superficial abdominal muscles. We want to work the deep ones that are going to control that area that supports your whole core system and your pelvic floor. So if you take an inhale and you stay nice and relaxed through those muscles, and then as you exhale, you draw your lower belly toward your spine or navel toward your spine just slightly, and you practice that. So you're integrating your deeper layer of your abdominals with your exhale, and then you allow everything to relax on the inhale. That is one way to start working those deeper layers of your abdominals that help support your core. Now, then you can integrate into some other more advanced exercises. We do Pilates-based exercises, but always working on the exhale when you contract those muscles and then inhale and allow them to let go. That is going to work the deeper area of your core. So strengthening your core muscles in different ways are going to help support your pelvis and your bladder. Then training the reflex. So there is a common reflex that is disrupted for many women that are having this symptom. So normally those muscles should contract and protect the bladder if you jump or if you cough or you sneeze. But for many women, we have to train that reflex how to work again, because those muscles just want to let go and don't want to support when you're putting more pressure on them. So how do you train this reflex? Well, you can actually do a little small Kegel exercise, but thinking of closing the vaginal area and tightening those muscles solely, and then doing a little fake cough. And find out if you are just letting go by feeling down there in that area, if you just feel like you let those muscles go, or you contract them and you try it again and see if you can keep that contraction. I find this is easier to do in a sitting up or standing position, but training that reflex how to work again is one of the key things that I see on how to connect your brain to your pelvic floor again. So something on training the reflex of how to work, that's definitely going to help with coughing or sneezing, but it is the first step to helping with the jumping activities as well. Then number 5 is working on isolated exercises to really help your glutes and your hip muscles, because these external muscles really support your pelvis and support that area around where your bladder is. You want those muscles to be nice and strong. So I'm talking about squats, I'm talking about lunges, deadlifts, things like that. If you're not integrating some type of weight training into your program, these are not high intensity jumping exercises, but they're very thorough in getting your glute muscles, which support the back end of your pelvis, and also just get those muscles working again. Now your pelvic floor, you can train that to work with your glutes when you are doing squats and lunges. But for the sole purpose of this video, if you're integrating some strength training, especially of your hip muscles, that's going to be a huge help to helping solve this incontinence issue for long term. Now, if you have not consulted with a pelvic floor physical therapist, I would highly recommend that. You can Google pelvic floor physical therapist near me, look one up. If you have questions or comments about anything in this video, I would invite you to please leave them below. There are so many things that can help stress incontinence, but it's important to know that you can solve it in a more holistic manner and don't need anything invasive to help it. So seeing a pelvic floor physical therapist, these are some of the top tips that I use with my clients, and you can start integrating on your own to see if you get some relief, and you can stop that embarrassment and stop wearing black yoga pants or pads when you go to the gym. You want to be able to jump without leaking. So if you like this video and you want to hear more about women's health topics, please hit subscribe to Level 4 Women's Health. And we give you more exercise tips, injury tips, and women's health topics on this channel. So I would invite you to hit subscribe. Thanks for watching.